Final video assessment, and this is head to toe, and I'm Carrie Evans. Hi, I'm Carrie Evans. I'm your nurse today. Your name and date of birth?
Jamie Winkle, September 10th, 1982.
And so that makes you
33.
Okay, so you look younger than 33. I'm going to just do a head to toe assessment if that's okay. If you could get up and let me watch you just walk a little bit, okay? Just walk down. Okay. And so you don't have to use any assistive devices or anything. Your gait is normal, so all of that is really good. We're going to just talk a little bit now.
Okay.
Who's the president?
Obama.
And the year?
2016.
Okay, and the day of the week?
Sunday.
Okay, so you're alert and oriented. You look very clean and well groomed. And you're pleasant. I notice you speak English. That's your native language.
Mm-hmm.
And so your nutritional status is good. You look healthy. And you appear, like I said, younger than your stated age. And so your posture was erect, upright. You were relaxed when you were walking. You have no obvious physical deformities, so that's good. And you're pleasant and cooperative. So I'm glad to have you here today to do this head to toe. So I'm going to check your skin. Is that okay?
Okay.
All right, let me wash my hands. Okay. All right. So your skin is warm and dry, and it's pink, has good turgor. I don't see any skin lesions. No edema in your extremities. And I'm going to take a look at your hands and nails, okay? Your hands look symmetrical. Your nails are smooth and normal texture. Check capillary refill here. Just how fast the blood returns once it's touched. And it's less than 2 seconds, so that's normal on your capillary refill. And so there's no pallor, no cyanosis, no hypopigmentation, and like I said, your skin's warm and dry and the turgor's good. So all of that is really good. I'm going to take a look now at your scalp.
Okay.
Have you noticed any lumps or bumps?
No.
No skin lesions. Your hair is normal texture. It's thick and a little bit coarse, but I don't see any thinning or anything unusual like that with your hair. And so we're going to take, I'm just going to feel the skull one more time. And it's rounded, normal, no depressions or lumps, and so it's normocephalic, and that's normal. And so the next thing that we're going to take a look at is the face. Your face is symmetrical, your nose is midline in your face, that's normal. Can you smile for me? Okay. Raise your eyebrows. Wrinkle your forehead. Yeah, there you go. Just grin. Grin. Frown. Puff out your cheeks. Okay, and all of that is checking for the cranial nerve 7, your facial nerve, which is intact. That's normal. And so the next thing I'm going to do is palpate your temporal artery. And so that is normal. I feel nothing bounding or unusual there, but it is present bilaterally. Okay, I'm going to check your lymph nodes now. I'm going to touch your neck, okay, and your face. The preauricular lymph nodes, postauricular, occipital, posterior cervical, anterior cervical, jugulodigastric, submandibular, mental, and the supraclavicular. And so I didn't feel any lumps, any swollen nodes, no lymphadenopathy there. And so that's normal. And so I'm going to now feel for the carotid artery, okay, just one side at a time. And it's normal contour with a brisk upstroke and a slower downstroke, which is all normal. And now I'm going to take a listen. I want to make sure that this is clean. Okay, so just take a breath and then let it out and hold it, okay? I'm just listening to your carotid. And there's no bruit, so that's normal with the carotid artery. And I'm going to just take a look at your trachea now. It looks midline in the throat, and it's not off center, or there's no shift in the trachea there, so that's normal. And I'm going to check your neck range of motion. If you'll put your chin down to your chest and then point your chin to the ceiling and then touch your ear over toward one shoulder and the other. Okay, all that was normal. And so I'm going to just have you to touch your chin down again. I'm going to test the strength in your neck. Try to raise your head. Okay, good. And now look down. Okay, so good strength there. Turn your head to the left. Turn it back to the right. Okay, good muscle strength. Turn it that way. Turn it back. Okay, so your neck has very good muscle strength, and so your cranial nerve 11, which is your spinal accessory, is intact, and so that's good. We're going to move on to your eyes, and we're going to just check the cardinal fields of gaze. If you'll just watch my finger, okay? Okay, and there's no nystagmus. Your eyes moved parallel and there was a smooth gaze with that, so that's normal. And that means that your cranial nerves 3, 4, and 6 are intact, and that's your oculomotor, your trochlear, and your abducens cranial nerves, all intact. So I'm going to look at your external eye structures. Your eyebrows are symmetrical. There's no skin lesions, no flaky skin. Your eyelashes turn slightly outward. They're both symmetrical and normal. And so I'm going to take a look. The sclera, which is the white of your eye, is China white. There's no cyanosis there. I'm going to just take a look now at the conjunctiva. And it's clear. Okay, I'm going to touch here. Pink in the lower lid. Okay, and the cornea looks clear and free of abrasions or anything like that, so that's good. And so your eyelids are not drooping. There's no ptosis, so that's normal. And I'm going to take a look now at the iris, and that's the color part of your eye. They're blue and round, and that's normal. I'm going to take a look at your pupils now, if I can figure out how to turn my light on here. Okay, and so if you'll just look at my finger again, and now look at the far wall. Okay, and then I'm going to just put the light here in your eyes and observe your pupils. Okay, and your pupils are equal and round and reactive to light and accommodation. So all of that is normal. And we're going to take a look at your ears now. Your ears are symmetrical bilaterally. I'm going to check and see if there's any tenderness when I touch. The cartilage is intact. The pinna, when I pull on it, is there any pain?
No.
And the tragus, is there any pain when I press?
No.
Okay, and there's no skin lesions. There's no discharge from either ear, and they both look really good. So, next thing I'm going to do is I'm going to turn you around, and I'm going to whisper some things, and you just repeat. This is a hearing test to check your auditory nerve, which is cranial nerve 8, okay?
Okay.
C3D.
C3D.
A7D.
A7D. M9N.
Okay, so cranial nerve 8, which is your auditory nerve, is intact, and so that's real good. And I'm going to have you to close your eyes and just tell me what you smell.
Strawberry.
Okay, so that is cranial nerve 1 that's intact, which is your olfactory nerve. So that's good. That's all normal. So that's great. And so I'm going to just take a look now at your nose. The nose is midline. I'm going to just take a look up inside. If you can tilt your head back slightly. And the mucous membranes are moist, and I don't see any drainage, and the septum is normal. There's no deviation there. And if you will, just sniff and sniff. Okay, so your nose is patent. In other words, that means it's open, it's not blocked or anything like that. And like I said, your mucosa is normal, moist, no drainage or exudate noted there. I'm going to take a look at your lips now. They're symmetrical, smooth, no cracking, anything like that. If you'll just open up, I'm going to take a look inside. And your tongue has a rough texture, which is normal. Raise your tongue for me. Okay. And the bottom of the tongue, the posterior is, the dorsal tongue rather, is glistening. I see veins present. And I'm going to look at your teeth and gums. There's no missing teeth, no dental caries, no gingivitis. The oral mucosa is moist and glistening. And I want you to say ah.
Ah.
Okay, and when you say ah, the uvula rises, which is the little fleshy part in your throat. And so that's normal, which means cranial nerve 10, the vagal nerve, is intact. And I hate to do this, but I'm going to have you to say ah again. And I'm going to see about your gag reflex. Okay, and your gag reflex is normal, which means that cranial nerve 9 and 10, the glossopharyngeal and the vagal nerve, are normal. And if you'll stick your tongue out, okay. And so cranial nerve 12, the hypoglossal, is intact. And I'm going to turn you around. We're going to take a look at the thyroid. If you'll just slightly tilt your head forward, just slightly, and then swallow. Okay, and there's no swelling or any lesions felt or nodules in the thyroid. Okay, so that feels normal. And this is part 1 of the head to toe Carrie Evans